Where you would be without your memory. This last day of November closes out the month of Alzheimer's awareness, but as Lisa Wojcicki reports, year-round communities across the nation will be performing tests for free to help you preserve your memory.
Waltine Benson is taking a mini mental status exam. The 10-minute test is used to determine whether she and millions of people every year have cognitive impairments.
I had a couple of strokes and I wanted to see how good I was doing.
With points assigned to each category, the test evaluates one's arithmetic, language use, and motor skills. Nursing students from Paterson University helped the nonprofit Home Care Options administer this round of tests at the Paterson Museum.
Questions that basically kind of ask you what your name, what's the date, but also things like, can you remember these 3 words? Can you count backwards?
Any score greater than 25 is effectively normal. A score of 9 points or less is severe, and mild is considered between 21 and 24 points.
I got a 20, which isn't very good, but I know that I'm working on my language and my alphabets.
Benson was referred to her physician along with Carmelina Dragon, who scored a 21.
You know, everybody forgets things, right?
Sure, everybody forgets things like where they put their keys, but Ken Wessel, executive director of Home Care Options, says the reasons for memory loss can be organic. For more than 50 years, his agency has provided professionally supervised health and social services. He says the test can be taken by anyone, but it's commonly used among seniors to determine risks for dementia, the most common being Alzheimer's disease.
You can intervene with Alzheimer's disease. Research has shown that if you start people on medications early on, you can really delay the onset of symptoms quite a bit.
And according to the American Alzheimer's Association, 81% of healthcare professionals notice symptoms of Alzheimer's 1 year or more before being diagnosed.
There's a lot of possible reasons for memory loss, not just age or Alzheimer's disease. And one of the major ones that can be taken care of pretty easily is medications.
Wessel says bad interactions with medications or taking too much of a certain one can cause the problem. Seeing how prevalent of an issue dementia may be in the senior community is something hard to forget for these nursing students.
From the textbook to actually applying it, it gives us first-hand experience, which is, I feel, very beneficial.
Actually meeting with the client and then actually performing the mini mental test, as opposed to just like pretty much reading it word by word and then interacting with the clients. Definitely a different experience.
While this last day of November concludes Alzheimer's Awareness Month, Home Care Options, based in Paterson, administers the test for free year-round to anyone in the community. You can call them at 973-523-1224 or go to nationalmemoryscreening.org to find a location near you. Reporting at the Paterson Museum in Paterson, I'm Lisa Wojcicki for WMBC News.